I'm John Schreiber. I'm Chairman of Pediatrics at Tufts University and Chief Administrative Officer of the Floating Hospital for Children. Tufts Medical Center and the Floating Hospital for Children have launched a new model of care in Boston where we help the community hospitals and the community hold on to children who should stay in the community for minor illnesses and then only transfer downtown those kids who will require tertiary and quaternary care. This is a distributed academic model in which we have faculty in the community helping manage the children who are admitted to the community hospital, and we have a specialty center right in the community, near the community hospital, to give backup and support to both the professionals taking care of the children in the hospital, but also to parents who need appointments and would prefer not to go to downtown Boston, but could have their children seen by the specialists in the community.
I'm Jerry Wartzman. I'm the Chairman of Pediatrics at MetroWest Medical Center. This is a partnership between two institutions that are sharing what really amounts to a brand new vision and delivery of care. What really made sense for MetroWest in terms of choosing Floating Hospital for Children as a partner for pediatrics was coming to understand the vision that Floating Hospital and Tufts Medical Center as a whole have for how medicine should be organized, which espouses keeping patients close to their homes to the maximum extent possible. And this really was completely congruent with what we were trying to do here at MetroWest Medical Center.
The Floating Hospital for Children is a freestanding 8-story children's hospital downtown Boston, directly adjacent to Tufts Medical Center. Inside the Floating, we have 120 pediatric beds and specialists in every possible specialty for pediatric care, including pediatric intensive care, neonatal intensive care, genetics, metabolism, infectious diseases, pediatric urology, you name it, we have it downtown.
So we've understood from the beginning of our planning and implementation of this relationship that outstanding communication between the hospital-based physicians and the primary care physicians was one of the absolute keys to the success of the program. The pediatricians in this community have known for a long time that MetroWest is a place where we have outstanding support staff and nursing staff and physician staff to provide care to the patients. Now with the additional higher level of services that are being brought into our community, the capabilities are even wider. Pediatricians should know when they send patients here that they're going to get the highest quality care available in their local community in a manner that is patient-centered and family-centered.
My name is Lisa Capra, and I'm the Director for the Pediatric Hospitalist Program at MetroWest and on the faculty at Tufts Medical Center. A hospitalist is a doctor that specializes in the care of patients who are admitted to the hospital. And so a pediatric hospitalist specializes in the care of children when they need to be hospitalized. Well, by having pediatric hospitalists at MetroWest, it allows us to keep more children in the community close to their homes, so that children who might have in the past been transferred into town because concerned that there wasn't an attending level pediatrician immediately available to care for them in the hospital, those children now can be safely cared for at MetroWest. As I see it, we're a link between the community hospital and the tertiary care center. So we have access to all the resources at Tufts Medical Center, including areas where they do research like neonatology. And so we can bring those findings into the community.
So MetroWest has a long history, nearly 20 years, of having pediatric expertise available in our emergency department. And that commitment to that higher level of service has become part of this Floating MetroWest relationship, and it's one that we are committed to continue and expand upon.
I am Kathy Rosenfield. I'm one of the pediatric hematologist-oncologists at the Floating Hospital. I'd like the people in Framingham to know that we are excited about coming out to Framingham to bring them the same type of care that we deliver to children in Boston, but in an environment that is more accessible for them and more convenient for them, which hopefully will make it easier for them to bring their child in to be seen. At the Floating, we really try to provide family-oriented care, which means involving as much of the family as we can. That's hard to do if you have to travel into Boston. It takes time from work, it takes time from school for the other kids. By being in Framingham and allowing the families to be closer to home when they need their care, it will help decrease that stress level significantly because they don't have to travel as far. They don't have to fight the Boston traffic. They don't have to worry about the parking. And they don't have to take as much time off from work, or the children don't have to take as much time off from school. It's a unique experience going into the communities. I think the families are much more comfortable when they're coming to a facility that's close to their home. They know how to get there. They feel there's a comfort level that you don't always see in Boston.